These webinars are an initiative of the Ohio State University Climate Change Outreach Team, a multi-departmental effort within the university led by OSU Extension, Ohio Sea Grant, and Bird Polar Research Center to help localize the climate change issue for Ohioans and Great Lake residents. I am Jill Gendis-Banicki from Ohio Sea Grant and Stone Laboratory. And joining me today are three speakers who will be discussing how a changing climate could impact our public health from a regional perspective to local health department and city perspectives. Starting our webinar will be Dr. Jonathan Patz, Director of Global Environmental Health at the University of Wisconsin in Madison, followed by Mike McNutt, Watershed Coordinator from the Cuyahoga County Department of Health, and Jane Goodman, City Council Member from South Euclid, Ohio. A few logistical aspects before we start. During our presentation, all participants will be in a listen-only mode. Afterwards, around 12:30, we will conduct a question and answer session. If you would like to ask a question during any of the presentations, please use the chat feature located on the lower right-hand corner of your screen, and Melinda Huntley of Ohio Sea Grant Extension will collect and pose your questions out to our speakers at the end of the last presentation. We have more than 200 participants in this webinar, a great diverse group representing health departments and hospitals around the Great Lakes region, governmental agencies, as well as academia and nonprofit organizations from around the country. So feel free to keep those questions coming throughout the presentation, and we will have an excellent Q&A session. As a reminder, this webinar is being recorded and will be posted on our website for later viewing. Without any further delay, I would like to introduce Dr. Jonathan Patz, Director of Global Environmental Health at the University of Wisconsin, who will present climate change in the Great Lakes, key vulnerabilities to public health in the region. Okay, Dr. Patz, I am going to unmute you and put you in as a speaker.
Okay. Thank you, Jill. To start off with, this overview slide gives a snapshot of some of the issues that we're thinking about as very concerning in the public health area, ranging from on top some of the health effects, direct effects of heat waves, to air pollution issues, and in the middle you see vector-borne, waterborne diseases. So infectious diseases are very sensitive to climatic conditions. And of course, in many parts of the world, food and water resources could be extremely important. And at the bottom, severe storms and sea level rise can lead to mental health, post-traumatic stress, and environmental refugee issues. But for the United States and the region, mostly going to talk about the top four issues. Now, certainly we know that people die in heat waves. We already have heat waves. We experienced that in Chicago in 1995 when over 700 people died. And the issue with climate change is not that the mercury is going to be creeping up gradually. It's not the average temperatures that we're so concerned about in public health. It's this frequency of extreme events. And what you see here is a graph showing the probability of having very hot days. So this is looking at, this is the city of Minneapolis, and it's the times where we've had temperatures up to or over 100 degrees Fahrenheit. Now, what you see at present, this is the blue bars indicate the present probability of having, in this case, we're looking at about 2 days that are 100 degrees or greater in Minneapolis. So if you look at the y-axis, this is about maybe a 17 or 18% probability that Minneapolis today, or in the current climate, will experience 2 days over 100 degrees. But with climate change, it's not necessarily that the days will get that much hotter, but it's the frequency of these extreme events that will increase. So now you see that 50 years from now, according to climate projections, that there is about a 60% probability that those extreme events will happen in Minneapolis. So this is what's concerning. Just like the heat wave that hit Europe in 2003 that killed over 50,000 people, no one can ever say, "Aha, climate change did that." You can't pin that attribution on a single event, something like that, on climate change. But the climatologists have said, based on the greenhouse gases emitted in the air for the last 30 years, that the probability of having that extreme European heat wave was doubled. The probability was doubled from greenhouse gases. So if we just move on, I'd just like to say that we have actually studied this in the region. We've looked at the heat waves in Milwaukee, and you can see that there are several health outcomes that are circled in red that where we see increases, certainly diabetes, respiratory disease, kidney stones, and genitourinary issues, and self-inflicted injuries. Maybe people can't stand the heat, and things get nasty, and it looks like this is interesting. We're not sure why. Maybe increase in suicides, but so we know that the heat is an issue with mortality and with morbidity. Now, I'm sure that those of you that are in this region recognize that city on the cover of Nature magazine. That is the city of Chicago. And that picture is an aerial picture taken during the heat wave in 1995. So heat waves it's just not the heat, but it's also stagnant air masses and air pollution that's harmful. And projections for by the middle of this century, just from warmer temperatures alone that affect the atmospheric chemistry and production of ground-level photochemical smog, or ozone, that warming alone will increase the dangerous red ozone alert days by 68%. That's leaving alone this other issue where the climatologists project that basically, I can use the pointer here. If you look at the yellow text here, that there'll be a decrease in frequency of surface cyclones, and in English, what that means is more stagnant air masses. Now, there have been studies in Chicago looking at ozone, and this is just these are different climate scenarios showing that across various climate scenarios, ground level ozone will be increasing with climate change in Chicago. Now, this is now steering towards the next presentations. I want to talk a lot about water here, and the next speaker will bring this to home for Ohio, I believe. But already we have problems dealing with stormwater, and this is a picture on the left of Niagara Falls depicting the amount of sewage-contaminated stormwater that overflows every year. More than 1 trillion gallons of contaminated stormwater overflows. It would keep Niagara Falls roaring for 18 days. So we already have difficulty dealing with storm runoff. And if you look at the EPA's map of municipalities that combine their sewer and stormwater, what you see is, over 700 communities still have these combined systems, and many of them are in the Great Lakes region. As you can see, these older systems, this whole area, lots of these combined sewer and stormwater systems. And if you look at the past climate, the last 100 years of climate, you can see that our region has experienced an increase in precipitation. So that could be a real stressor on our water systems. And just focusing in further, about these combined sewage overflow events, CSOs, and the drinking water, in this region, we're talking about 40 million people, 500 beaches, and, there's a lot of contamination after stormwaters. as shown in this image. This is from my collaborator, Dr. Sandra McClellan at the University of Wisconsin-Milwaukee. What you're seeing is an aerial view of Milwaukee, and these are the streams coming in into Milwaukee Harbor. And these flaming hot blue dots indicate very high levels of E. coli when they sample the water after a storm runoff. The red is slightly less, but still pretty hot here. And then, of course, it dilutes out. But notice at this beach, flaming blue hot, high numbers of E. coli after this storm runoff, and also this other beach, pretty high numbers. So the water definitely gets contaminated after a storm, the surface waters. Now, we conducted a study looking at all waterborne disease outbreaks reported since from 1948 to 1994. And we found that about 2/3 of these reported outbreaks were preceded by heavy rainfall events. So we really think there's a relationship between heavy rain and disease. Well, what does this have to do with climate change? Well, this graph, which is a very important graph, comes from the U.S. Global Change Science Program. And what it shows is the type of precipitation that is projected for the future. Now, in the middle, what you see is moderate precipitation events. And down here, these are sort of light events, just light drizzling events. And those are pretty much stable. But it's these very heavy rainfall events, the heavy precipitation, that is expected to increase. And simply, hot air holds more water. So when it rains, it can rain much harder. So the projection for the world is not necessarily more rain all over the place, but the type of rainfall will be heavier rainfall, which for the reasons I've shown in the last few slides could present problems for public health. Here in our region, we've been looking at what the nature of rainfall may look like, at least for our state of Wisconsin. And these are projected changes in the frequency of 2 inches of precipitation per day. And you can see that a pretty significant increase in heavy rainfall events for Wisconsin. Moreover, when will these rainfall events happen? And this shows that, this is actually for the Chicago region, that generally it's the spring. The spring time will have heavier or more rain, and the spring will also have more of these very heavy, the high precipitation, extreme precipitation events. And if you're thinking about frozen ground, and when do you want to have water, which would be nice if you had water in the summertime, which you see you don't have a lot of water in the summertime. We're going to get more rain, and it could be at the wrong time. Well, I always like to end on an upbeat tone because there is hope here, and I think our last presentation is going to talk more about some of these issues, about why there's some actions that we can do in the face of climate change that could be good for our health. Now, here are some very obvious ones. According to the World Health Organization, 1 million people die prematurely every year from air pollution. And when you think about climate change, which is, the most abundant gas is CO2. Well, what produces CO2 are mostly industry, transportation, residential heating and cooling, but it's fossil fuel. Fossil fuel creates climate change, and it also creates conventional urban air pollutants. And here we have 1 million people that die every year from air pollution. If we were to reduce our fossil fuel burning for climate change, we'd also have some gains in this for public health. And of course, there's also the automobile-dependent society and lack of exercise. That's another problem, potential benefit if we solve that and had green cities and green transportation, but I'm not going to talk about that in this presentation. I do want to remind you that most of our leading causes of death in this country, and I've circled the majority, are related to three things: either sedentary lifestyle, air pollution, or motor vehicle crashes. So here, if we had green cities, we could deal with, we could reduce that. Here's one natural experiment that you may recall during the Olympics in Atlanta in 1996. Because of, they wanted clean air for the athletes, they restricted traffic. And traffic decreased by 23%, with a resulting drop in ground level ozone dropping 28%. As a result of that, asthma-related ER visits by children fell by 42%. Which was striking. Now, of course, you have to ask the question, as these epidemiologists did, was it because people weren't driving to the emergency room, and they found that non-asthma admissions to the ER absolutely the same, no change. So this is, I think, a very good study that shows you take the cars off the road, you reduce traffic and pollution, you absolutely see this benefit. So here's a wonderful opportunity. If we were to get away from internal combustion engines and reduce our fossil fuel combustion, we could really have a significant immediate public health benefit. We're actually trying to run scenarios and quantify the benefit in the Great Lakes region. And what we've done is we've taken national transportation data, and we have looked at short trips between 4 and 8 kilometers, which represents 20% of vehicle miles traveled in the region. And what we did was we assumed that all of those short trips were done by non-internal combustion engine transport. And so basically you're taking 20% of the vehicle miles traveled, you're eliminating that. What would it mean for air quality and public health? So 20% fewer car trips. What does it mean for ozone and particulate matter, which is, of course, harmful to population health? I won't give the exact numbers because this paper is still in review, but basically hundreds of lives saved, actually hundreds of thousands of hospitalizations avoided, and billions dollars of healthcare costs are eliminated. So absolutely a win-win situation in this case if we can reduce our fossil fuel dependence in this case. I want to just wrap up by reminding the audience that right now, of course, there's a lot of debate about what we should do about climate change and energy, and there's so much focus on this bottom number. What is the cost of getting away from oil and coal and reducing the tons of carbon dioxide emitted, and they're talking about somewhere under $30 per ton of CO2 removed. But what they don't focus on is the fact that there are benefits. So if you were to reduce the fossil fuel, reduce the CO2 and reduce fossil fuel pollution, the health benefits, this is across studies around the world, are about $49 per ton of carbon dioxide removed. So that benefit is far greater than this cost. And this is completely absent from policy discussions. So I think it's very important when we think about, in adapting to climate change, we need to include these co-benefits stemming from mitigation policies and not just focus on the fuel cost. Of course, people do forget the subsidies there. But anyway, I think it's really important to bring in these co-benefits, and I think our third speaker will be talking about this as well. So with that, I thank you very much for your attention, and I'm trying to advance my slide here to give a website and my email, but it's not working. But I thank you very much.
Thank you, Dr. Patz. Now I would like to introduce Mike McNutt. Now that Dr. Patz went through some of the regional aspects, Mike is going to go through some of the local. He is the Watershed Coordinator for the Cuyahoga County Department of Health, and he will be presenting climate change and watershed management. Mike?
Yeah, hey, thanks, Jill. I appreciate that. Thanks, Dr. Patz. That was a fantastic presentation. I'm attempting to advance my my PowerPoint here, so bear with me just for a second. Yes, so here we go. Great. So my name is Mike McNutt, and I'm a watershed coordinator here at the Cuyahoga County Board of Health. And I appreciate the opportunity to discuss some of the things that we're doing here at the county level from a health department perspective. I think it was really unique that I was given the opportunity to be hired as a watershed coordinator to work for a health department. In fact, I am the only watershed coordinator employed through the Ohio Department of Natural Resources program, watershed management program, to be employed at a health department in the state. So this kind of portion of the presentation is going to kind of look at maybe some things that to some folks are sort of common sense, but also some of the things that we've seen by walking some of the streams and being in the lake, and some of the other studies that have been done, and perhaps even looking at some of the significant issues that climate change will have on water management itself. So presumably most people know what a watershed is, but just in case people still think it's a shed in your backyard that stores water, we'll just kind of make sure that we have all on the same page with the definition. So a watershed, in essence, is nothing more than an area of land that drains to a central location. And typically, I like to think of myself as a droplet of water gently falling from the sky, and if I land on one side of a divide, I will flow to a central location, and if it just so happens I land on the other side of a divide, I will then flow to another location. So a simple but understandable concept. Sometimes I also like to, when I also give presentations to others, like to think that maybe a good way to have a connection to folks is to think of the vascular system with the veins and arteries in the human body as being sort of an internal watershed. So the small little tributary streams that you may run through your backyard and so forth eventually go to a larger vein or artery and so forth until it gets to a main vein. And of course, that usually, in our case here, will dump into one of the Great Lakes. So some typical causes of impairment that we find in most of our watersheds, at least in an urban setting, but this could probably be found in most settings, would be anything from organic enrichment, so many so decomposable materials, grasses, leaves, things like that, to ammonia, to toxicity situations, oils, and things like that. However, I don't know if most people understand that the number one pollutant that there is nothing more than sediment. So oftentimes you will drive over a stream or over a bridge and you will see chocolate sort of water, and that is because of sedimentation, mostly because of erosive properties of the soil banks or stream banks, but oftentimes also exacerbated by, construction sites that perhaps are improperly managed. So we obviously have to talk about the significance of the Great Lakes in this discussion. So this is just a photograph or a depiction, I guess, of the watershed drainage area to all of the Great Lakes. So some quick facts. The Great Lakes comprise of about 1/5 of the world's fresh surface water. Only the polar ice caps and Lake Baikal in Siberia contain more. If you spread all of the water across the continental United States, the Great Lakes would submerge the country under about 9.5 feet of water, so there's quite a bit. And I think that for us, in terms of Ohioans, one of the biggest, most, concerns is that we have about 3 million of us only in Ohio that use Lake Erie as its primary source of drinking water. So it is a significant resource just from that kind of perspective as well. So in our discussion today, I'd like to look at this slide as climate change impacting a lot of different areas, but we're going to kind of focus specifically on water availability and the quality of that water. One of the impact areas I think was omitted from this is the economic impact that climate change might have, not just in Ohio, but as well as the Great Lakes states itself. So what is some of the climate change risks associated with public health? Well, some of them Dr. Patz has already kind of gone over, But, poor air quality, clearly there's going to be asthma and allergens. My allergies have been killing me the last few days. Increased flooding, heat island effects, drought, the lowering of lake levels, increased water pollution, food shortages, pathogens, so forth and so on. So a whole slew of issues that are clearly married to public health and some of the corresponding water quality and other risks associated with that. So how will climate change specifically impact our state of Ohio? Well, first of all, on average, the ambient air temperature, and this is really here in the 21st century, so up until maybe 2100, you can see that in the winter you might have an average increase of 7 to 12 degrees Fahrenheit, and maybe in the summer a little bit more. Dr. Patz has already alluded to that maybe on average the rainfall might not change too much, but there will be variability in precipitation over some of the summer and winter months. So we can maybe look at maybe drier conditions, but more acute precipitation events in the summertime. And I think that's something that's going to have a major impact on water quality in general. Extreme events, so perhaps more 24-hour and multi-day events that will increase over time. Reduced lake levels and increased in lake area water temperatures, and I would say that's across the board in all the Great Lakes. So this slide just simply depicts sort of an average or a guesstimate of reduction of lake levels. As you can see, Lake Erie, maybe by close to the end of the century, maybe down close to 4 feet. This, again, I believe Dr. Patz had a slide very similar to this. Basically, in my layman's terms, the larger dots mean an increase in, 7-day duration precipitation events over the last, 40 to 50 years. And we can see that perhaps this trend will continue into the future. There's also one other issue I think that we need to kind of briefly go over, and it is the Great Lakes Water Compact. This was recently signed a few years ago by all of the Great Lakes states as well as Canada. And what this means is that we basically set some regulations that we all have agreed to abide by, so to not outsource water from the Great Lakes region to other areas. We're at a point now where we need to start implementing what this compact means. And for what this kind of, is where the discussion should to go would be to remove water for the Great Lakes for consumption, for bottling, and things like that. But basically what they, meaning some of the scientists had looked at, is what we're going to do is look at the streams that feed the lake. They usually have a biological criteria that they follow, and at least in the state of Ohio and perhaps in all the other states, that we have exceptional warm water, limited resource water, and modified. So that means that those streams have been given a designation to indicate what their quality of water is. So a lot of the withdrawal amounts that have been discussed at this point in time range from about 100,000 to 5 million gallons a day from the different lakes. Ohio proposes a 2 million gallon withdrawal to be allowed for, for consumption or for industrial use. And just as a little caveat, recently Put-in Bay started importing water for their Labor Day weekend because of significant algae bloom issues. And so that is something just to think about as we continue this discussion about reducing lake levels and increasing the contamination or pollution going into them, having detrimental impacts on some of our festivities as much as it is for water intakes for folks. So water quality and public health concerns with climate change. It might be obvious to a lot of people to not allow cattle and other livestock into streams. This may be joyous to those animals during hot summer months, that they can frolic and enjoy themselves in cool waters. But for us, they also contaminate different types of excrement, pathogens, and bacteria from their processes by allowing them to have free range into the streams. One of the biggest issues, as I kind of alluded to, is sedimentation. And in this case, our agricultural runoff, and especially in Lake Erie, with having the Maumee watershed being the biggest watershed or contributor to Lake Erie, has a significant amount of agricultural runoff. And we all know that fertilizers, which would be composed of nitrogen and phosphorus adhere to, at least the phosphorus adheres to the soil particles. So when we have these acute precipitation events, which seem to be something that will be continuing into the future, we may have more runoff going into the lake and the corresponding algae blooms. This is something that has become a standard in my mind. This is just an aerial photograph of Lake Erie, the western Lake Erie Basin, which you can see to your left is on average about 25 feet in depth, and as I said, way over to the far corners where the Maumee Watershed flows into the lake. As you can see, a lot of this is algae blooms and sediment blooms associated with the runoff. This is just another picture of a kind of like a marine area in Lake Erie with a microcystis bloom. And this, I think, is really cool because NOAA is starting to look at doing HAB, harmful algae bloom sampling within the western Lake Erie Basin. And what I did was take the liberty of providing some of the recommended use limitations when it comes to harmful algae blooms. So if you're going to drink water, a recommended level is 1 microgram per liter of having contaminated microcystis in the water. And as you kind of move up, it can get all the way up to a 20 micrograms per liter, and then of course above that is just high recreational risk. So when we look at this, and I'm sorry, I think this slide's a little bit out of focus. There, I had highlighted some in red, and I believe that they're a little bit lower than this, so I apologize. But going back, what these are basically looking at, the high marks are going to be in the WE7, WE9, and WE6 sampling locations, which, as you can tell, are in the Maumee Bay Basin. And so what that means to us is that as the sediment comes out, and because of the shallowness of Maumee Bay and Maumee Bay, we're seeing that there's more incidences of high algae blooms when it comes to harmful algae blooms. So why do we care about this? Well, these harmful algae blooms are basically cyanobacteria, which are blue-green algae, and some of these blue-green algae produce toxins, hepatotoxins and neurotoxins. And what these can do is they can destroy liver cells as much as they can impact the nervous system. When we recreate in waters like this, of course, we either are swimming and we inundate ourselves in them, or we are wading and we have our skin coming in contact with them. Or worse is that we have a jet ski or a boat and we are actually aerosolizing some of these toxins, in which case we are breathing them in, and that can really cause a lot of significant upper respiratory issues and asthma-like symptoms, in addition to perhaps even getting into our bloodstream, and that's where we can see some neuro issues associated with that. So this is kind of like bad stuff that we're starting to see much more frequently in the western basin of Lake Erie. I wanted to kind of demonstrate this. I had been really trying to research if there's a comprehensive model that's being performed or being researched to look at the amount of runoff concerning different scenarios that actually is going into Lake Erie and the western basin. As you can see, NOAA is starting to look at some of these models to demonstrate some of the sort of vast information that we're trying to compile that needs to be compiled to really get an idea of predicting where and when and how awful some of these harmful algae blooms could be occurring. Another thing that I guess we're starting to look at, or I guess some of the NOAA folks are starting to look at, is if fish consumption with those fish species that are in the western basin or just happen to come into contact with some of these harmful algae blooms, if there is sort of a fish tissue bioaccumulation impact, similar to the whole DDT and bald eagle, can we transfer some of these toxins to humans through fish consumption? So something else that is now being looked at as well. We have to talk about, just briefly, some combined sewer overflows, but Dr. Patz has clearly articulated a lot of this information much more than I'm going to, or much more than I can. But this is just simply a picture of a combined sewer overflow occurring. Oftentimes we see that there's beach closings associated with a lot of the E. coli that is contaminating the beach area. We, from the Board of Health, look at beach safety, and we are actually sampling multiple beaches in the county. And these ones in particular are now underneath the Ohio Nowcast. which is a website that one can go to if they're looking to go to a beach. These three specific beaches are mostly monitored or have been monitored quite a bit by the Board of Health and by the Northeast Ohio Regional Sewer District. Just for everybody's kind of understanding, a beach advisory usually is implemented when E. coli communities exceed 233 communities per milliliter of water. Looking at this slide, it just kind of gives you an idea of the multiple different beaches that are in the region that have been sampled and the average E. coli levels over sample time. The Board of Health, if you look down maybe about halfway through, down to Huntington Beach, we had 100 sampling days, which means that we literally went out 7 days a week and sampled the beach for E. coli communities. And out of those 100 sample days, there was 10 times where it exceeded the threshold of the 235 communities per milliliter. Some of the higher ones that we've seen in the county are Euclid State Park, Edgewater Beach, and Villa Angela State Park. Now, granted, there might have been significant days in between sampling days because maybe those have not been sampled as frequently as we have for Huntington Beach. But as you can see, on average, there has been quite a high E. coli contamination level there. To take it one step further, there's not a lot of information that has been performed thus far looking at bather beach studies, but one in particular here looked at the high sensitivity of children to swimming associated with a GI illness. Basically, about 21,000 interviews were performed at 4 different beaches in Ohio and in in Michigan. About 7.3% of those respondents reported new GI illnesses, 9% in children, 5.7% reported upper respiratory infections. As you can see, the children are going to have much more of an impact because of exposure to these E. coli communities than others. Another issue that we see often here in Cuyahoga County is failing sewage or home sewage treatment systems. We have about 9,000 to almost 10,000 total active systems. Out of those, we have about 1,400 that are failing. And in addition to those, we have about 3,700 that are aged 50 years or more. And the average lifespan of these systems is 25 years. Most of these either discharge into a receiving body of water and or go into some type of leach bed, which perhaps could even be introduced, these contaminants could be introduced into the groundwater supply. So some photographs of what we've done to our water. I said sediment is often the #1 pollutant. As you can see, this is just sediment pouring into our stormwater system, which usually goes right out into our receiving bodies of water. A lot of times we see walking in streams litter and debris that is carelessly discarded. As you can see, somebody could even been just driving over an overpass, tossing trash bags into streams. We can obviously see a major eutrophication of our bodies of water with excess nutrients being inputted into these systems. We can see grease, oils, and fats and undigested food oftentimes being introduced into our waterways. We can see, again, more sediment from unmanaged or carelessly managed construction sites that often go into our waterways. Leaky cars with hydrocarbons going unabated into our storm sewer systems. And one of the biggest things is too much water from the vast impervious surfaces that we have that are going into our streams, which are causing a lot of the sedimentation issues as much as they are flooding issues downstream. So in starting to wrap up here, some of our Cuyahoga County Board of Health programs, traditional programs from a health district perspective, looked at all sorts of things from household sewage to semi-public sewage to food safety to nursing and community health. But we've expanded that to look at so many different things that are kind of starting to in our opinion, starting to look at new and emerging public health concerns. So as you can see, there's a lot of issues that we're starting to tackle, and we're starting to implement new programs here to start addressing some of those. So what have we been doing? Well, we've been working with a lot of communities and stream restoration projects, even as simple ones like this, where we're just simply peeling an entrenched stream bank back and then we're laying down and seeding this with grasses and other type of Ohio native vegetation, and then securing it with erosion control blanket until the vegetation has a chance to occur, like this in Twinsburg, Ohio. This is a picture of a stream restoration project. This used to be a very entrenched stream, similar to the photograph I showed you before with the orange barrels laying in the bottom of it, where you've peeled the banks back, reseeded it, and now the stream has access to its floodplain again. So when there's floodwaters, it actually has some place to go. We're also looking at stormwater management like this that has been done in our next speaker's neck of the woods in South Euclid, which is a wonderful stormwater project. So the Board of Health is slowly starting to get involved, maybe not in this specific project, but in other stormwater-related projects. In fact, the Board of Health actually does all of the stormwater work, or the vast majority of the stormwater work in Cuyahoga County for all of the communities. We are looking at wetland studies where we looked at the economic value of wetlands and the nutrient sequestration of values, so we can educate our community and our community officials about the significance of wetlands. We often do stream cleanups in urban streams where we pull out a lot of trash, which also engages the community and the officials about the importance, the significance of clean streams. We have to look at agricultural management practices, which is something that some of my colleagues in the Western Basin are much more engaged in than I am, but these are simple grass filter strips. Here's some other depictions of some simple methods that can be utilized in agricultural practices to remove contaminants and sediment from entering our waterways. And we can also, look at green infrastructure as sort of a new, idea of how to keep water on site rather than having it run off and have it used in proper ways. This is a picture in Washington, D.C. of the National Botanical Garden, rain garden, or you can just have one simple in our backyard like we've did in Columbus, Ohio here, and one of my friends' backyards. Again, stream restoration projects like this one at Highland Hills in Cuyahoga County on Mill Creek. Simple rain barrel out in people's backyards to keep your downspout runoff and utilize it for your gardens. Bioswales in some of our parking lots that help remove a lot of the impurities from the water column and runoff from the impervious surface there. So with that, I want to thank you for giving me the chance to talk to you about these things, and if anybody has any questions, I'll be more than happy to answer them with you. So thank you.
Thank you, Mike. I'd like to now, for our last presenter, I would like to introduce to the group Jane Goodman, City Council member for the South Euclid area, a suburb of Cleveland, who will be presenting climate change in City Hall, what local governments need to consider. Please feel free to ask any questions you would like through the chat feature. Jane.
Thank you. Thank you, and thanks for coming. Sorry about that slide. What it says is climate change in City Hall, what local governments need to consider. In addition to being a councilman in the inner-ring suburb of South Euclid, I am Outreach and Communications Director for the Cuyahoga River Community Planning Organization. That's the RAP. And I'm the only elected official in this region that actually comes from the environmental field. So I appreciate the Dr. Patz and Mike's sharing with us the really bad news, the scary stuff, because we as local governments are the ones that have to face these things to make our constituents, our residents, our business owners, our property owners, our visitors' lives good in the face of these changes that are facing us. So we're going to talk about what we do, what we face, barriers. Are you hearing me? Oops. Barriers to moving ahead with some of the important things we have to do in terms of mitigation, preparation, adaptation, communication. Mitigation is what we're mostly focusing on now. You know, how can we reduce the impacts of global climate change? When what we really need to be focusing a little more on is preparation for the change and adaptation to the change. The quote at the bottom, my experience in government is that when things are non-controversial and beautifully coordinated, there's not much going on. Said by John Fitzgerald Kennedy, it's true. I'm going to make generalizations. Don't get offended. Your experiences will differ. We have some hard facts to face, and I don't need to be soft. So I want you to bear in mind, because what I'm hoping will come out of this is that you will carry this back to your local governments where you live. First of all, you guys know about this. Most public officials are clueless. Most public officials have little or no education or training about this stuff. We're mostly part-timers. Ignorance is not, in fact, bliss, and it could be fatal. You elect these people. So you need to focus on one thing you can do as professionals, but as citizens. We all need to pay attention to who is paying attention to these issues. So what we do is we keep our residents and businesses and property owners safe and secure. We have the police departments, the fire departments, and we manage emergency response, which is going to be more and more important. We provide those services that improve or maintain your quality of life. We truck away the waste, we schlep away the snow, we suck up the leaves, we provide some social services, we deal with traffic and transportation and recreation. Recreation is something we'll come back to later. Construction and maintenance, we take care of the infrastructure. We plan the land use. So these changes in land use planning for green streets and green cities and bioretention areas and wetland maintenance, these fall under our purview. We do these things to support the quality of life, and in order to do all those things, we collect and expend money, taxes, grants. We manage the budgets, and our budgets are getting tighter and tighter and tighter. I like to use the part of the preamble of the Constitution as the overall theme for people to think about what governments do. And that's at the bottom of the screen. Establish justice. Well, we the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, that's my favorite, and secure the blessings of liberty to ourselves and our posterity. So this is what our overall thing is. And here's what we're going to face. We're going to face physical effects that my colleagues have described to you in depressing detail up to this point. We will have economic effects. Funding is being reduced from federal and state sources. It's being shifted to other states, other regions for relief and mega projects. I don't remember if I have this on another slide, but Kelvin, I think you're in the room. Some of the money that we were hoping to use for sediment testing for removal of a dam on the Cuyahoga River, it ain't going to come this year. It might come next year. The delay is because there had to be money shipped up to the Kalamazoo River oil spill cleanup. And so limited resources shared over a wider area. There are silver linings in these clouds, and it's up to us to find them. So as we have been talking about, oh, have an abundance of fresh water. The Great Lakes is all this clean fresh water. We hold the key. We hold the water. Everybody's going to benefit from this. But with lake levels dropping and health issues coming up, as we just heard, some will gain. People will be moving to this region from coastal areas around the country or warmer areas. We are going to get an increase in people. Our property values can go up by virtue of the temperature issue. Businesses can relocate here. I hate to say will, but okay, I'll say will. Businesses will relocate here. In-migration will rise in geologically safe areas, and others will lose populations. We're expecting in the Great Lakes region to benefit from this. We have to think as local governments about shifting our emphasis and what services we provide now that we might not be providing as much of, other services we don't provide now that we will be providing more of, and we have to look at our capacity with these population shifts and the effects. And then we have to deal with the public pushback. I like to use the Kubler-Ross model for climate change. That's the 5 stages of grief, because I see this happening already. First, it's denial. It's a hoax. Second is anger. Okay, fine, but it's not our fault. Who can we blame, and who can we get to pay for it? Third is bargaining. Okay, fine, so maybe it's partly our fault, but we'll need to commission our own study just to be sure, and really, we'll get to it as soon as we can. Fourth stage is depression. Oh my God, we've waited too long. It's too big. We can't stop it. We may as well sit on our hands and do nothing. And then it's, okay, fine, we better do something. What do we do? Anybody in the audience who knows me will be shocked to see that I am quoting Dick Cheney. However, this is a very useful idea for those people who are reluctant to do anything about this. This was said in a different context, but if there's a 1% chance, fill in the blank, we have to treat it as a certainty in terms of our response. It's not about our analysis, it's about our response. And what we need to do is learn from history, plan with timelines, deadlines, and seriousness, involve our stakeholders, every level of them, and above all, don't make things any worse. So mitigation, trying to reduce the existence or effects, at least, of climate change involves, obviously, things that have been discussed before, converting to non-carbon sources of energy, reducing the amount that we do use. Cities are notorious for cop cars sitting idle. We are our own worst enemies. There are things everything you see on these screens, there are opportunities here. The silver linings, as I call them, money that can be saved to be shifted to where we need it. There are business opportunities in every step along the way. There are new products needed, new businesses started, new services required. And the economic development function of a city is to make those happen, give them a good home, and support them along the way. Let's see. So, Resilient Cities is a terrific book, and I recommend it highly. And this quote comes from that. In New Orleans, the resilience of the city was reduced by the loss of wetlands and mangroves. We know that. But the main human disaster came about because the transit system was inadequate. There was no plan for using the assets that they had, school buses and other transit vehicles. So the resources themselves were lost. the transport system was not resilient, and that undermined the rest of the urban systems. So we need to look at our assets. We need to educate our decision makers. We need to decide who's going to handle what. Right now, our city hires the Cuyahoga County Board of Health to handle its public health issues. Some of those are going to overload their capacity. What do we need to do ourselves? What do we need to count on others to do? And the thing that I am hoping becomes a central focus of conversation pretty darn quickly is how are we going to adapt to climate change? Because global climate change is going to affect us as much as local climate change and regional and Great Lakes Basin-wide. But we have to figure out, for example, I talk about we've sealed ourselves into tall office buildings where you can't open the windows anymore. Well, okay, right, heat rises. So if we keep building up, we are going to deal with buildings that require the use of energy. If you can't open the window, you have to heat it and cool it using energy. Other examples, pools. We're closing pools because we don't have the money to operate them. This is happening in cities all over the country. Recreation has dropped to the bottom. But if we're not able to send people to the beaches, they're going to need cool-off spaces. We don't have the capacity for to handle big disasters on our own, although many of our communities are developing community emergency response teams, CERTs, but we don't have the shelters. In walkable distance, if you don't have a transportation system, your services have to be delivered locally. We don't necessarily have those dispersed in the right places. These are the kinds of things, the KISS principle, keep it simple, stupid, open a window. We may have to adjust work schedules for longer heat spells. Change the way we work, change the way we move. Cities themselves will have to change the way we mow our lawns on public property, or we call it get your rugs off drugs. Efforts to reduce and continuing to reduce the amount of nutrients and herbicides that we use on our public lands. And of course we need to communicate with each other, communicate with you folks, communicate with our stakeholders especially. We need to tell people where to go. And I mean that in many ways, but what I mean primarily at this point is in case of an emergency, where can you go? In case of that severe winter event, is there a place for that mother with the 2-month-old baby to go spend a few hours at 2 o'clock in the morning when the problem hits to find heat? Is there a place, a way to get elders from hot upstairs apartments to cooling centers in heat events? We have to tweak our thinking. For example, for years we believed in send the runoff to the curb, let it go over the curb into the catch basin, rush it and flush it through that sewer system, out of sight, out of mind. Now we all have to think backwards. Get the runoff off the street into a bioretention and filtration basin in the curb. Oh, and by the way, thanks, Mike McNutt, for showing an old picture of our built wetland. at some point I will get you a reference to a new picture, because in just 1 year, that is working. It is so grown. It is so green. It is our deer buffet. It is an amazing structure. And by coordinating and collaborating with a lot of partners, that can happen everywhere. And we need to get our physical communication networks up to snuff. We need to be creative. A lot of our service directors are getting together to talk about these things. We are taking advantage of every drop of funding possible to do green streets and hopefully green roofs, to campaign. But we need to do it now, and we need to be really creative. And this is where the benefits come. There are opportunities for new products that can be built in our cities and bring jobs. There are opportunities for flexible. We have to be flexible. We're closing schools. If we get new populations because of this, we're going to have to school them. And yet we're closing schools and we're tearing them down. So we need to focus more on adaptive reuse of facilities, put pools back, get recreation higher on the list. And there are many creative ways to do this, and I love this quote. The most successful people are those who are good at Plan B. So I recommend that there are two very interesting and pretty much diametrically opposite books that I recommend everybody read. The first is Resilient Cities. It has as much to do with peak oil as climate change, and a lot about mitigation, but a lot about adaptation as well. And then Climatopolis, which is by Matthew Kahn out at UCLA, the subtitle being How Our Cities Will Thrive in the Hotter Future, from creative destruction to new opportunities for green businesses, green industries that we can share. I go to ICLEI. It's a hugely valuable resource for local governments and anybody else who talks to anybody they know in any local government. ICLEI Canada has a fantastic Changing Climate Guide and Workbook. Chicago, of course, is ahead of the game, and Toronto as well. Call me if you need anything. There's my number. Thanks.
Okay, thanks, Jane. At this point, I'd like to turn this over to Melinda Huntley. We're going to do some question and answer period. I would like to, we've got a great set of questions, but feel free to keep asking them through the chat if you have others, and we'll just keep going with these until about 5 till, and then we'll wrap up. So I will turn this over to Melinda.
Hello, everyone, and thank you for your questions. We've got quite a few. Keep them coming, though, in the chat box, and we're going to start with some questions for Dr. Patz because he has another commitment earlier, so we want to start with his questions. Our first question for you, Dr. Patz, is climate change likely to affect cancer incidence? And can you explain a little bit about your perception of that?
Well, I have to think about that. Cancer is not something that we directly link to climate change. The extent of where cancer may come in is simply through exposures to air pollution. I don't know how directly related lung cancer is. It's not. It's more a matter of chronic pulmonary obstructive disease, asthma, and other respiratory ailments, including and cardiovascular ailments with air pollution. But if if there's a change in the emissions to deal with heat waves, and you have electric power demand, and we have more air toxics, in theory. But there really has not been much done connecting cancer. If there's a change in the amount of clouds and potential UV, that's an area. But again, these are very, very indirect and really speculative. So I'd be hard pressed to say that there's much to do with cancer when we think about the health effects. But in some cases, maybe we're just looking at the light under the lamppost, and there could be issues there.
Great, thank you. We have another question for you, Dr. Patz. The attendee says, the worst effects of climate change seem to occur in 50 years or so. What should we be worried about as far as potentially large health effects in the next 10 to 20 years?
That's an interesting question, and I think it's an important question because climate change has been occurring, since the beginning of the Industrial Revolution, and basically it's very difficult to tease apart the effects from climate change versus other changes, like other infrastructure changes or populations moving around. And to be honest, in many cases, climate change is already upon us. There was a World Health Organization study that asked the question, the climate change that has occurred in the last 30 years, what is the influence on public health? And they picked four outcomes and came up with, a few 100,000 deaths per year. And basically it was a pretty simple analysis, just looking at four outcomes when in fact there are many others. So I don't view this as something out 50 years from now. Things are already happening. It's hard to say, okay, are we there yet? 50 years. The problem is that climate change may be an irreversible process. If we get to the point where we continue to emit greenhouse gases, knowing full well that the inertia of the climate system is such that the pollution we put up today lasts in the atmosphere for 70 to 100 years, we need to make sure that we are proactive and understand that. So the 50 years from now issue is that the actions that we do today will continue to influence the climate and ultimately our health over the next 50 to 100 years. So I think that's where it's really a here and now issue that simply could become exacerbated, and if we don't do something soon, could sort of spin out of control, and that would be unfortunate. A quick note that a recent study that from the National Academy of Sciences, proceeding of the National Academy, pointed out that if we have business as usual as far as emissions and burning fossil fuels, we could, by the end of the century, reach temperatures that are basically beyond human adaptability. So this is where, the timing is very important.
Okay, excellent. I want to remind everyone it's not too late to post a question. You can post it in the chat box at the lower right-hand corner of your screen. Our next question is for Mike McNutt. Does climate change play a factor on nutrient impacts in the water? And if so, can you explain a little bit about how?
Yeah, sure. Of those fertilizers into the water column. So I think that a lot of the issues associated with degradation of water quality and the current practices that we have, or lack thereof, I suppose, when it comes to not just agricultural practices, but also a lot of the work or a lot of things that we individually do or we as communities do. And I think Jane kind of really articulated that quite well. where, we're even still having issues with if somebody wants to put a rain barrel at their home, there are ordinances typically in those communities that forbid downspout disconnects from your storm sewer system. So, even those small little hurdles still need to be overcome. And of course, we still implement the standard traditional engineering and development practices that we all know, where if we need to create a new shopping center, where we could go by 364 days out of the year, see the parking lot with that is not completely filled up, but that one day a year, there's ordinances that dictate how many parking spaces need to be available, and usually that's for the volume the day after Thanksgiving for the start of the official Christmas shopping season. So there's a lot of things that we still do that we need to really look at and change, and I think that a lot of the nutrient problems that we see are based upon the not implementing management practices that we already know exist. There needs to be a huge educational outreach endeavor in order for us to utilize some very simple but important management practices. So I hope that answers the question.
Great, thank you. This next statement in question is really thrown out there for all three of our speakers. We will take responses in the order that you presented. Those of you involved in Great Lakes Water Quality Agreement negotiations for a new modernized agreement know that there's a little or no attempt to include human health and preventative mitigative measures in the new agreement. What could the impact of ignoring this be for state, provincial, and municipal governments' abilities to act on these costly solutions without federal support? And we'll start with a response from Dr. Patz.
Well, I think knowing the broad, various exposures through which climate change can affect our region, I absolutely think it's critical that that we are preparing for example, increases in extreme events beyond what they are now. That we need to be as far as heat waves as well. I think the key thing I would say for this is simply that, in general, we need to couple our adaptation and mitigation strategies and be very comprehensive. When we look at, for example, dealing with storm runoff over impervious surfaces in cities, we need to look at the fact that if we were to reduce the amount of asphalt and have multimodal transportation, you could solve several things at the same time. You could promote healthy cities and reduce runoff and reduce the urban heat island. So in anything, we need to take a very integrated type of approach to the problem. And I leave it to the other speakers who know more about the compact and the legislation.
Mike, do you have anything to add?
Yeah, I think that Dr. Patz has clearly articulated things with spot on. But I also think that one of the things that we seem to everyone is probably, or most people I guess, probably listening in on our conversation would agree that climate change, in fact, is a reality, and it is something that we need to deal with. I think that there's still this huge disparity or argument of whether or not climate change is actually occurring. And, regardless of taking the politics out of whether or not humans are actually influencing that, the fact of the matter is the science indicates that, in fact, there is an evolving climate, that we are going to see impacts in the short term and perhaps even the very long term, where we have to adapt to those changing climates. People don't like change. People don't want to even think that change is occurring because it requires people to get out of their comfort zone. But and Jane can probably speak to this much better than I can in regards to what communities could be doing to be even more proactive. I kind of look at it from more of the personal behavior changes having the cumulative impact, for the for the good of the whole. So, and as far as the compact is concerned, I really think that the spirit of the compact was to make sure that the water in the Great Lakes remains in the Great Lakes, and that, you know, it's not that we're being stingy about the fact that we don't want to outsource the water to other locations or sell it off for somebody's profit, but it is there because it has been there. And I think Jane's right. I think we will see a huge resurgence of this area of the country, the Great Lakes region, with a population increase because everyone needs water. Obviously, 60% of our body is made up of water. So I think the spirit of the compact is there. I'm just concerned that we're going to start dismantling it because of, you know, either profit or because of other you know, influences that are kind of taking, you know, hitting, I guess, again, what the compact is all about. But maybe Jane can explain a little bit more about what we can do in terms of communities or the compact, maybe more than I can.
Hey, great. Jane?
Or maybe not. It's a huge issue. We talk a lot about regionalism, and yet we don't define what regions we're talking about. We always look at ourselves as the middle, I mean, no matter who we are, as the center of the universe. But if you do look at it as the middle of a target, with Great Lakes basin cities and towns and townships and villages as centers of targets, and then concentric circles spreading outward as you expand your definition of regionalism. The danger is that you look for a solution for the whole area, the whole region. And we talk about Great Lakes as if it's that kind of all-encompassing region, and the compact looks at the basin as a region, and in many cases adjusts to local needs, preferences, political priorities. I will admit that aren't always the best way to look at things. So two things need to happen. One is, I should back up a little. In addition to the regionalism thing, what's going to be needed for the preparation and adaptation to climate change is a little more localism. It's that walkable neighborhoods that allow less use of carbon-emitting vehicles, carbon-consuming vehicles, access to services, that kind of localism, and then the regionalism, collaborations and cooperations. But one size certainly does not fit all. And we need to identify what things have to be local. Wetlands serve a local area. We need enough distributed storage throughout local areas to manage stormwater and nutrients and pollutants. And then we also need to respect and honor our place in that big outside ring that's the Great Lakes. I know this was a convoluted answer, but the bottom line is we have to think globally and regionally and locally when we do things like compacts. When we give, when we set aside, when we let one of our partners do something that isn't necessarily in keeping with the spirit of a compact, and we have to be prepared to do as much as we can locally. Survival is a local issue, and if it gets that bad in some event cases, we need to be able to shift into survival mode, and that's not a regional thing, that's a local thing.
Okay, great. And I'm going to ask another question directly to you, Jane, that came in that's kind of related to that, and it has to do with how do you prioritize among a multitude of needs? Do you tackle the easiest first or the most necessary first? And the question came in is, how can climate resilience via our local supply chains really be developed in our just-in-time economy? We have very limited resources, yet we are dependent upon drugs, manufactured goods, agricultural products, other resources produced in faraway places. And then went on to ask about the prioritization. Can you respond to that one, please?
I like the mitigation, preparation, adaptation model for a lot of different things. Because it can be translated in very different circumstances, and in the decision making and prioritization circumstance, it works pretty well. We do tend to choose the urgent over the important, and it depends on who defines urgent, and that's the problem with prioritizing. But if we make ourselves define the urgencies and the actions in terms of whether we're avoiding or preparing or adapting on a timeline, that's going to allow us, and this is something that I'm hoping to see spread throughout more and more local government decision making, is that put these on a timeline, and then you know what you do first, what you invest in to see happen next, and what's the long-term investment. I hope that answered the question, but that's how we do it, and that's how I try to do it in my city.
Great, thank you. And one last question. Again, this is for you, Jane. Should cities put more resources into health departments at climate changes or into emergency services?
Yes. Oh, you actually wanted an answer. The answer is yes. I think that some of the functions that we push off on the health department are things that we really could be taking care of if we had greater community involvement, such as the CERT teams, the community emergency response teams that I mentioned before. We work collaboratively with the teams in the communities around us, and we staff the points of the point of dispensing. Sorry, we had PODs for the H1N1 vaccine at our schools. It worked terrific. We can engage a bunch of trained people when needed. Those are kinds of things that we can do ourselves, or health departments with, or medical delivery services with. So in some cases that can serve. Did that answer the question?
Yes, thank you. Thank you. Well, we're about out of time, so I just want to kind of wrap up. What we'll do is we had several more questions, and we will pose those questions out to each of the presenters, have them answer, and we will post those along with the webinars themselves on the website. I want to, again, thank Dr. Jonathan Patz, Mike McNutt, and Jane Goodman for their willingness to talk to us today about public health issues as they relate to a changing climate. A really excellent discussion. Also, a thank you to the Cuyahoga County Department of Health and the Great Lakes Water Resources Program for helping to sponsor this webinar. I did want to mention that resources on public health and climate change are located on our changingclimate.osu.edu website. Besides resources recommended by the speakers, we also feature several of Ohio State scientists who are doing great things in public health research. From Dr. Liang's research investigating how viruses will react in developing countries to climate change, to Drs. Buckley and Lee's research to find a faster way to test for E. coli levels in lake waters here at home.